Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Let's begin. Question 1. A nurse is preparing to administer insulin Lispro to a client with diabetes. When should the nurse administer this medication? A. 30 minutes before meals. B. Immediately before meals, within 15 minutes. C. At bedtime. D. 1 hour after meals. Correct answer, B. Immediately before meals, within 15 minutes. Rationale. Insulin Lispro is a rapid-acting insulin that begins working within 15 minutes. It should be administered just before meals to reduce the risk of hypoglycemia. Question 2. Which insulin has the longest duration of action? A. Regular insulin. B. NPH insulin. C. Insulin glargine. D. Insulin Lispro. Correct answer, C. Insulin glargine. Rationale. Insulin glargine is a long-acting insulin that provides a steady insulin level for approximately 24 hours without a pronounced peak. Question 3. A client receiving insulin suddenly becomes sweaty, shaky, and confused. What is the nurse's priority action? A. Administer a fast-acting carbohydrate. B. Administer more insulin. C. Encourage exercise. D. Restrict fluids. Correct answer, A. Administer a fast-acting carbohydrate. Rationale. These are classic signs of hypoglycemia. If the client is conscious and able to swallow, give 15 to 20 g of a fast-acting carbohydrate such as glucose tablets or fruit juice. Question 4. Which insulin can be administered intravenously in an emergency? A. Insulin glargine. B. NPH insulin. C. Regular insulin. D. Insulin detamir. Correct answer, C. Regular insulin. Rationale. Regular insulin is the only insulin routinely administered intravenously, especially in emergencies such as diabetic ketoacidosis, DKA. Question 5. Which statement by the client indicates the need for additional teaching? A. I will rotate my injection sites. B. I will inject insulin into my abdomen. C. I will massage the injection site after giving insulin. D. I will check my blood glucose regularly. Correct answer, C. I will massage the injection site after giving insulin. Rationale. Massaging the injection site can increase insulin absorption and may lead to hypoglycemia. Injection sites should not be massaged. Question 6. Which insulin should appear cloudy in the vial? A. Regular insulin. B. Insulin Lispro. C. NPH insulin. D. Insulin glargine. Correct answer, C. NPH insulin. Rationale. NPH insulin is an intermediate-acting insulin and appears cloudy. It should be gently rolled between the hands before use. Clear insulin should never appear cloudy. Question 7. When mixing regular insulin with NPH insulin, which insulin should be drawn into the syringe first? A. NPH insulin. B. Regular insulin. C. Either insulin. D. Long-acting insulin. Correct answer, B. Regular insulin. Rationale. Remember, clear before cloudy. Draw up regular, clear, insulin before NPH, cloudy, to avoid contaminating the regular insulin vial. Question 8. Which symptom is more consistent with hyperglycemia? A. Sweating. B. Tremors. C. Frequent urination. D. Dizziness. Correct answer, C. Frequent urination. Rationale. Hyperglycemia commonly causes polyuria, polydipsia, polyphagia, blurred vision, and fatigue. Question 9. A client asks why they should rotate insulin injection sites. What is the nurse's best response? A. To reduce pain only. B. To prevent lipodystrophy and improve insulin absorption. C. To decrease the need for insulin. D. To avoid infection completely. Correct answer, B. To prevent lipodystrophy and improve insulin absorption. Rationale. Repeated injections at the same site can cause lipodystrophy, leading to unpredictable insulin absorption. Question 10, bonus SATA. A nurse is teaching a client about insulin administration. Which statements are correct? Select all that apply. A. Rotate injection sites within the same anatomical area. B. Monitor blood glucose regularly. C. Shake NPH insulin vigorously before use. D. Carry a fast-acting source of glucose. E. Inject rapid-acting insulin shortly before meals. Correct answers, A, B, D, E. Rationale. A. Rotation helps prevent lipodystrophy. B. Regular monitoring helps maintain glucose control. C. NPH insulin should be gently rolled, not shaken. D. Carrying glucose helps treat unexpected hypoglycemia. E. Rapid-acting insulin should be given shortly before eating. Question 11. A client receiving insulin becomes pale, shaky, and diaphoretic. The blood glucose level is 52 mg per deciliter. What should the nurse do first? A. Administer insulin. B. Give 15 g of a fast-acting carbohydrate. C. Encourage exercise. D. Notify the healthcare provider immediately. Correct answer, B. Give 15 g of a fast-acting carbohydrate. Rationale. The client is experiencing hypoglycemia. If the client is conscious and able to swallow, administer 15 to 20 g of a fast-acting carbohydrate, then recheck the blood glucose in 15 minutes. Question 12. Which insulin has an onset of approximately 30 to 60 minutes? A. Insulin Lispro. B. Regular insulin. C. Insulin Glargine. D. Insulin degludec. Correct answer, B. Regular insulin. Rationale. Regular insulin is a short-acting insulin with an onset of 30 to 60 minutes and should generally be administered about 30 minutes before meals. Question 13. A nurse is preparing to administer insulin Glargine. Which action is appropriate? A. Mix it with regular insulin. B. Administer it once daily as prescribed. C. Shake the vial vigorously. D. Give it intravenously. Correct answer, B. Administer it once daily as prescribed. Rationale. Insulin Glargine is a long-acting insulin given once daily. It should not be mixed with other insulins or administered intravenously. Question 14. Which symptom is most consistent with hypoglycemia? A. Dry mouth. B. Frequent urination. C. Sweating and tremors. D. Fruity breath odor. Correct answer, C. Sweating and tremors. Rationale. Sweating, shakiness, hunger, palpitations, and confusion are common signs of hypoglycemia and require prompt treatment. Question 15. A client asks where insulin should be injected for the most consistent absorption. Which site should the nurse recommend? A. Abdomen. B. Buttocks. C. Upper back. D. Calf. Correct answer, A. Abdomen. Rationale. The abdomen provides the fastest and most consistent absorption of subcutaneous insulin. Question 16. A client is prescribed both regular insulin and NPH insulin. Which statement by the nurse is correct? A. Draw the cloudy insulin before the clear insulin. B. Draw the clear insulin before the cloudy insulin. C. Mix the insulins only after shaking both vials. D. These insulins should never be mixed. Correct answer, B. Draw the clear insulin before the cloudy insulin. Rationale. Remember the NCLEX rule, clear before cloudy. Draw regular, clear, insulin into the syringe before NPH, cloudy. Question 17. Which laboratory value indicates that a client's diabetes has been well controlled over the past 2 to 3 months? A. Hemoglobin A1C of 6.5%. B. Blood glucose of 250 mg per deciliter. C. Urine ketones present. D. Random glucose of 300 mg per deciliter. Correct answer, A. Hemoglobin A1C of 6.5%. Rationale. Hemoglobin A1C reflects average blood glucose over approximately 2 to 3 months. A value around 6.5% indicates good long-term glycemic control for many adults, though targets should be individualized. Question 18. Which instruction should the nurse include when teaching a client how to store insulin? A. Freeze unopened insulin. B. Store insulin in direct sunlight. C. Keep unopened insulin refrigerated and avoid freezing. D. Always keep insulin at temperatures above 100 degrees Fahrenheit 38 degrees Celsius. Correct answer, C. Keep unopened insulin refrigerated and avoid freezing. Rationale. Unopened insulin should be stored in the refrigerator and never frozen. Opened insulin may generally be kept at room temperature according to the manufacturer's instructions. Question 19. A client taking insulin plans to begin an exercise program. What should the nurse teach? A. Skip meals before exercise. B. Monitor blood glucose before and after exercise. C. Increase the insulin dose before exercise. D. Exercise only when blood glucose is low. Correct answer, B. Monitor blood glucose before and after exercise. Rationale. Exercise can lower blood glucose and increase the risk of hypoglycemia. Monitoring helps determine whether additional carbohydrates or insulin adjustments are needed. Question 20, bonus SATA. A nurse is teaching a client about preventing hypoglycemia while taking insulin. Which instructions should the nurse include? Select all that apply. A. Eat meals on time after taking insulin. B. Carry a fast-acting source of glucose. C. Monitor blood glucose regularly. D. Skip meals if blood glucose is normal. E. Wear medical identification indicating diabetes. Correct answers, A, B, C, E. Rationale. A. Eating meals on schedule helps prevent hypoglycemia. B. Glucose tablets or juice can quickly treat low blood sugar. C. Frequent monitoring helps detect low or high blood glucose early. D. Skipping meals while taking insulin increases the risk of hypoglycemia. E. Medical identification helps emergency responders provide appropriate care if needed. Question 21. A client with diabetes says, I don't feel any symptoms even when my blood sugar is low. Which condition should the nurse suspect? A. Hyperglycemia. B. Hypoglycemia unawareness. C. Diabetic ketoacidosis. D. Dawn phenomenon. Correct answer, B. Hypoglycemia unawareness. Rationale. Some clients, especially those with long-standing diabetes, may not experience the usual warning signs of hypoglycemia. This increases the risk of severe hypoglycemia and requires frequent blood glucose monitoring. Question 22. A nurse is preparing to administer regular insulin. Which syringe should the nurse use? A. Tuberculin syringe. B. Insulin syringe. C. Oral syringe. D. 5 ml syringe. Correct answer, B. Insulin syringe. Rationale. Insulin should always be administered using an insulin syringe, or insulin pen, calibrated in insulin units to ensure accurate dosing. Question 23. Which assessment finding indicates that insulin therapy has been effective? A. Blood glucose decreases from 320 mg per deciliter to 130 mg per deciliter. B. Blood glucose increases to 350 mg per deciliter. C. Positive urine ketones. D. Fruity breath odor. Correct answer, A. Blood glucose decreases from 320 mg per deciliter to 130 mg per deciliter. Rationale. A blood glucose level returning toward the target range indicates effective insulin therapy. Question 24. A client asks why blood glucose should be monitored before meals and at bedtime. What is the nurse's best response? A. It helps determine whether your insulin dose is working. B. It's only necessary when you're sick. C. It replaces your A1C test. D. It prevents insulin allergies. Correct answer, A. It helps determine whether your insulin dose is working. Rationale. Regular glucose monitoring helps evaluate treatment effectiveness and detect hypoglycemia or hyperglycemia early. Question 25. Which instruction is most appropriate for a client receiving insulin during illness, sick day management? A. Stop taking insulin until you feel better. B. Continue taking insulin as prescribed and monitor blood glucose more frequently. C. Skip meals and insulin. D. Exercise vigorously. Correct answer, B. Continue taking insulin as prescribed and monitor blood glucose more frequently. Rationale. Illness often increases blood glucose levels. Clients should continue insulin unless instructed otherwise and check blood glucose more frequently. Question 26. Which client is at the highest risk for hypoglycemia? A. A client who skipped breakfast after taking rapid-acting insulin. B. A client who ate a full meal after taking insulin. C. A client who checked blood glucose before eating. D. A client who drank water before meals. Correct answer, A. A client who skipped breakfast after taking rapid-acting insulin. Rationale. Rapid-acting insulin begins working quickly. Skipping a meal after administration significantly increases the risk of hypoglycemia. Question 27. Which symptom should a client report immediately after starting insulin therapy? A. Mild hunger before meals. B. Recurrent episodes of confusion and loss of consciousness. C. Feeling thirsty after exercise. D. Slight bruising at the injection site. Correct answer, B. Recurrent episodes of confusion and loss of consciousness. Rationale. Confusion and loss of consciousness suggest severe hypoglycemia, which is a medical emergency requiring immediate evaluation. Question 28. A nurse is teaching a client how to rotate insulin injection sites. Which statement by the client indicates understanding? A. I'll inject into the exact same spot every day. B. I'll rotate injections within the same body area before moving to another area. C. I'll only use my arm. D. I'll massage each injection site afterward. Correct answer, B. I'll rotate injections within the same body area before moving to another area. Rationale. Rotating within the same anatomical region provides more consistent insulin absorption while preventing lipodystrophy. Question 29. A client with diabetes becomes unconscious because of severe hypoglycemia. Which medication should the nurse anticipate administering if 4-access is not available? A. Insulin glargine. B. Glucagon. C. Metformin. D. Regular insulin. Correct answer, B. Glucagon. Rationale. Glucagon is used to treat severe hypoglycemia when the client cannot take oral glucose and 4-access is unavailable. Question 30, bonus SATA. A nurse is teaching a newly diagnosed client about insulin therapy. Which statements should the nurse include? Select all that apply. A. Carry a source of fast-acting glucose at all times. B. Rotate injection sites to prevent lipodystrophy. C. Wear a medical alert bracelet or necklace. D. Stop taking insulin whenever blood glucose is normal. E. Monitor blood glucose as instructed by the healthcare provider. Correct answers, A, B, C, E. Rationale. A. Fast-acting glucose helps treat hypoglycemia promptly. B. Site rotation helps maintain consistent insulin absorption and prevents lipodystrophy. C. Medical identification is important in case of emergencies. D. Insulin should not be stopped without healthcare provider guidance. E. Regular monitoring helps guide treatment and detect abnormal glucose levels.
What is your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.